Good afternoon. Good vision is something we count on for ourselves and our families. We want our kids and grandkids to see well so they can do well at school. And we want to preserve our own vision so we can keep doing all the things we want to do. How can we keep our eyes healthy and do the same for our families? This will be our discussion for today. I'm Dr. Anju Goyal. I'm an ophthalmologist at Wayne State University in Detroit, Michigan. I'm here today as a representative of the National Eye Institute. NEI's National Eye Health Education Program is working to make people aware of steps that they can take to protect their family's eye health. Every year, the National Eye Institute and our dedicated partners celebrate Healthy Vision Month in May as an opportunity to raise awareness about ways to keep your eyes healthy. This year, the focus of NEI's Healthy Vision Month is on families, specifically highlighting ways that parents and caregivers of Black and Hispanic and Latino families can help their children and teens, as well as themselves, take care of their own eye health and model eye healthy behaviors for their children and loved ones. We're calling this conversation Healthy Vision, a family focus, because we know how important parents, grandparents, and other relatives are in influencing their family's health decisions. We'd like to thank all of NEI's Healthy Vision Month partners this year, and especially want to thank the organizations who contributed to the Healthy Vision Month work group and who helped recruit speakers for this event. These include Children's Eye Foundation of APOS, Bright Focus Foundation, Prevent Blindness, Black Eye Care Perspective, CDC's Vision Health Initiative, the National Optometric Association, and the American Academy of Pediatrics. We are excited to discuss healthy vision with our panel today, and we invite you, the audience, to join in the conversation by asking your questions in the chat. We'll answer audience questions at the end. Before we get started, I'd like to offer the other speakers a chance to introduce themselves. In 1 to 2 sentences, can you each state your name and share why you chose to be on this panel today? We'll start with our 2 eye doctors on the panel. Dr. Humes, would you like to go first?
Absolutely. Thank you, Dr. Goyal. Hi, everyone on the internet. Thank you for joining us today. My name is Dr. Tiffany Humes. I am an optometrist, which is a primary eye care doctor for the eye. I practice in an urban setting in Detroit, Michigan, and Henry Ford Optimize. And I'm here today because I'm really excited to be able to spread to you all of the good information that I give to my own patients every day. So thank you for being here with us, and I hope you learned something.
Thank you, Dr. Humes. Dr. Yoo, could you please go next?
Hi, my name is Sylvia Yoo. I'm a pediatric ophthalmologist at Tufts Medical Center in Boston. I'm a member of the American Academy of Pediatrics, which is how I got involved in this panel. And I'm here to help educate anyone who's concerned about or interested in their children's vision and eye health. Thanks.
Thank you both for being here on our panel. And we are so fortunate to have 3 parents and caregivers on our panel today. Sandra, could you please start?
Licensed vocational nurse with one of the nursing home in San Francisco. And I have a daughter with oculocutaneous albinism. And I just want to be able to express and tell the public how it feels to be able to take care of a condition like that, which is a rare condition. So I'm happy to share that with other parents. Thanks for having me.
Thank you, Sandra. We're fortunate to have you. Patricia, would you like to go next?
Daughters, and my youngest had eye vision problems, and luckily we were able to catch it early on. And I'm happy to be here to encourage parents to get their children's eyes checked.
Thank you, Patty. And Felisa, would you like to go last but not final?
Good afternoon, everyone, and thank you for inviting me, Dr. Goyal, to participate in this very, very informative and important panel. I'm Dr. Hume's mom. I just wanted to get that out there because we're very proud of her. I am an educator in the Wayne County school district and here in metropolitan Detroit. I'm a caregiver for a 93-year-old mother who has glaucoma and just underwent successfully cataract surgery, and the mother of a 35-year-old son who has keratoconus. And we're beginning that journey of arresting that disease.
Thank you all for being here and really sharing your heart and journey with so many. And I'd also really like to thank you, the audience members, for being here. I think it makes it very special that we can collaborate together on these types of channels so that we can all learn from each other together and really try to help empower everyone in eye care and your overall health. Thank you. Next, we're going to start off with a few questions for our eye doctors. So this is a question for Dr. Yoo. Dr. Yoo, if a patient has a question, if eye diseases run in my family, what can I do to prevent my child from developing the same condition later in life?
I think one of the first things you can do is talk to those family members who has that eye problem and find out more about what the problem is and when it started. So there are some eye conditions that can start in childhood. And so if that's the case, and if there's a strong family history of that, it makes sense for your child to go in for a full eye exam. But then there's some eye conditions that really don't develop until later into adulthood. So that would be the time when your child and of course other family members should get evaluated with a full eye exam to see if there's any risks of developing that eye disease in the future. There are other health problems that can sometimes run in families that can increase the risk of developing eye problems later on. And so should those other health problems, such as diabetes, should those develop, that would be a time for your child or family member to have an eye exam done.
Thank you. That's very helpful. Dr. Yoo, can you expand on what are some of the common, eye conditions that children have, some of the most common that you see?
Yeah, I think the most common is just the need for glasses or refractive error. So that could include nearsightedness or myopia, which is when far away vision is blurry. That can include astigmatism, where the shape or the curve of the front of the eye is different from somebody who doesn't have astigmatism and is also treated with glasses. And then it also includes farsightedness, also called hyperopia. And it's normal for young children to have some amount of farsightedness, but sometimes there can be a large amount of farsightedness, which also needs to be treated with glasses. The other conditions that I see often in my office are what's sometimes known as a lazy eye, and that can include abnormal development of vision in the vision part of the brain, which is also called amblyopia. And that can be due to different causes, including sometimes a very high glasses prescription. And sometimes it can be due to another condition, which is also sometimes called lazy eye, called strabismus. And that's a misalignment of the eyes. So that can be eye crossing, where one or both eyes cross, or sometimes eye drifting, where one eye drifts out. And so both amblyopia, which is abnormal vision development, or strabismus, eye misalignment, are some of the more common eye conditions that I see in my office and affect about 3% of the population.
Thank you very much, Dr. Yoo. That was very informative. Dr. Humes, can you expand a bit on what Dr. Yoo was talking about? What are some of the signs or red flags parents should look for in their children that could indicate a problem with eye health?
Absolutely. So some of them are the ones that we all know, like squinting or kind of really straining the eyes to see things. Young children will often walk up on objects so they can see them well. That doesn't always mean that they have a refractive error, but sometimes it does. It means that they can't see it well, so they walk up on it until they can see it clearly. You may also have some things that are less common, like headaches. Especially like an end of the day headache could be more of a sign of farsightedness if the child's been straining their eyes all day to see while they're at school, or hyperopia, as Dr. Yoo was explaining before. Other things might be avoidance, so avoiding reading, because they can't see things clearly. So they avoid reading altogether. Children in general are very inquisitive and they want to learn new things. So if you see your child start to avoid something, that usually means something might be going on there. Other things might be inattention in class. And then the last one, which is somewhat more uncommon, is excessive blinking. And so the child is constantly blinking to try and make things come into focus for them, and it doesn't seem to be coming into focus. But I tell parents, you know your child best. So if the child starts to tell you that something doesn't seem right, they usually do mean that, because in general, children don't know they don't see well. Because they assume that everyone else sees just like they do because that's their life experience. So if your child is doing something that seems abnormal to you, absolutely take them in for a full eye exam. And then the last one, of course, is if the child fails a school screening or a vision screening at the pediatrician. I know we're going to talk about that a little bit more next, Dr. Goyal, so I'll stop there.
Thank you. This is very helpful. Thank you all for sharing such great insights. Now let's transition to hearing from our parents and caregivers about their experiences caring for their family's eye health. Sandra, this first question would be great for you. What are some of your biggest concerns regarding your children's eye health?
Thank you. Well, I would say I have three kids, and the most, the, the oldest one that I'm mostly concerned about is the one that has albinism, the oculocutaneous albinism, a condition of the eye that affected the skin. As a result, she has poor vision and she has nystagmus. And my concern when I was when I had her, she was not seeing very well. Because she was always bumping into stuff. But I got concerned about that. I took her to the doctor, and even when she was born, to her has been known that she has that condition. And the doctor followed up with it at San Francisco General. They were very good, and they told me these are the things I'm gonna be experiencing with her, bumping into stuff, and she can see colors very well. I started using glasses, but my greatest concern was that she was going to be avoided in school, be discriminated against, and because of her color of her skin, and she won't be able to learn properly because she can't see those prints very well, even with the glasses. So those were my concern. I was also concerned when she gets to adulthood, how she going to advocate for herself. So my that was just the San Francisco School District also started helping me out with looking for resources for her and to help her be able to have some good accommodations with the IEP in school and make sure she sits in front of the class. Then I got better with that a little while, but as she grows older, at about 10, 11, it became worse that every time we have to go to the clinic eye exam, and she didn't have a regular doctor at that time. I got concerned about that because I needed an ophthalmologist that is really, really in depth with this condition. They will now find Dr. Benwick, she's been very nice to us, and so all my concerns just kind of went down like that because she was already advocating for her and giving her all the resources and writing letters to the school for her accommodation. I was on top of it. San Francisco School District, and she has an IEP vision impairment teacher. We call them teacher of vision impairment. So he was also advocating for her too and making her get all the resources for her. So those are where my concerns about learning, how she can be able to be with people in school and not being intimidated and all that. Yeah, let me stop there for now until any other question comes up.
Sandra, thank you for sharing that. And you bring up an important point that we can have body diseases that can affect our eye. And for the audience members, Sandra's child has oculocutaneous albinism, which means that her skin pigment is lighter, and that can also mean that the eye development, some of the pathways that we need to process vision can be lighter and underdeveloped. And so Sandra has been the cheerleader for her daughter to navigate this. And I think what Sandra's really trying to convey is that by persevering and looking for the right specialist, that she did find a network of support and is seeing her child do better. And so I will tell you, as a glaucoma specialist, I think I shared with you, I had a 70-year-old patient with a similar condition that your daughter has, and he has a very thriving life. And so just like you have started to reach out for your child and give her the support, they can, really accomplish a lot with a lot of love, family support, and the eye care community. Valisa, I'm going to reach out to you next because you mentioned that you have different generations of family members who are dealing with eye issues. How do you keep your family's eye healthy overall? How do you do that and juggle that?
So I think, well, for me, it was how we started, right? So for my son, it was growing up knowing that we get our eyes checked. It's something that we do yearly. And then once they started, maybe my daughter had to wear glasses. Hers was every 6 months. So eye care was just as important as the physical care in our family. So that foundation was laid. And then my mom had laid that foundation with me. So it was easy then when it was time for me to advocate for themselves with them, because my advocation wasn't with an external entity, but with the individuals that I was giving care for. I had to advocate on their behalf with them. Was the first thing was recognizing that they both were adults and respecting that. That my position, it was very different. It had changed from mom to counselor coach with my son. And I have to keep in mind that I'm daughter caregiver with my mother. So the first thing was to educate myself about what they were dealing with, what the doctors were saying, and then listening for what is not being said, because what's not being said is usually what's not being done. And so my mother for years always talked about she's very sensitive with things in her eyes, and that she would go and get her eye exam and she would tell the doctor, well, yeah, I don't have glaucoma. My eyes, they always blink when that air goes in. And, so I said, so, well, maybe you've always had this condition, but for years she was in denial. She didn't have that. She didn't matter. She became the doctor, and she convinced her doctors. I mean, to the point she was adamant, to the point where they were able to provide her caregiving. So for my mom, it was actually an opportunity to allow her to come to a place where she realized that this was serious, that this was something that needed to be addressed. So for her, it was timing. For my son, it was more, how do I help him out of the same denial, but knowing that I have a little more juice with him, right? Because you're my son. And so in both cases, it was talking to doctors to find out what was being said to them during their visits and what their diagnosis was, and not what they thought they had. So I could actually speak to them about what the diagnosis was as a point to what they think they had. And so, and when my mother got to the point where she couldn't see some things on her television, because that's what was important for her, she said, well, maybe I need to go and look into this. And so immediately then my job was to make sure she got to where she needed to go and that we provided that care. For my son, it was knowing when to be mom and when to be coach. And it got to the point, by the third time he came and said that he had been diagnosed with keratoconus, I had to have a come to the mountain top with him and remind him about how this was very, very important and this foundation had been laid, and that I was very disappointed that now as an adult, when he gets to engage these skill sets and engage these values, he's fallen short. And we did that at Christmas with the family. So immediately he got back to, when he, upon his return to Arizona, he called with, I've done this and this and this and this. And so it was advocating, realizing that sometimes the advocacy isn't with a third party, but advocating on their behalf with them.
Thank you for sharing that. And I think that's a really important point, is that family support or community support or friend support really helps encourage the family member who might be dealing with the eye issue. And one of the hardest things I find is that it's not obvious when someone, if you look at someone's eyes, you can't always tell that they have an eye issue. And so being there, and you address the fear and the denial that's there. So being a supportive family member and caregiver can really make the difference in having your loved one really do well with their eye care. And I know everyone here in the audience is here for that reason, to, how to protect that for their loved ones and themselves. Patty, I was going to turn to you next. What was your experience like when you and your child went to the eye doctor?
I'm sorry. The experience was pleasant. I went to a children's eye specialist, Dr. Radunovich. So she's geared just to children and small children. I mean, and it was very eye-opening to see that there was children even younger than my daughter. She was initially checked at the age of 3, but there was, 2-year-olds in there. So that was nice. And there was definitely, it was very child-friendly. And she did a very thorough examination, and she was able to explain to me, what was going on with my child. So it was pleasant. It was a good experience.
That's great. And to follow that up, Patty, how do you now work with having 2 young children with eye issues? How do you work to keep your family's eye healthy in general?
Definitely with the basics. So just a little backstory. I'm first generation American here. My parents came from Mexico, so we grew up very poor. We didn't have health insurance. We didn't do preventative medicine. We only went to the doctors when we were sick. And I live in a border city, so we would go to Mexico to get care. So preventative medicine was not something we practiced. We just, we didn't go to the doctor till we were sick. And so I didn't grow up with yearly eye exams or yearly dental, or cleanings or anything like that. So for me, with my children, I did take them to the pediatrician, but I never thought to do the eye thing and the dentist thing. And that was just something that I didn't grow up with. So I didn't initially do it with my kids, but then my husband encouraged me and he did grow up with all of that. So I think the number one thing we can do for our families is just to get checked, have them their eye exam. And I think early on, even before they get to school, because that way they don't have an issue when they start school. And as the other doctors were saying, them not wanting to learn to read, or them not engaging because they can't see, they just want to not deal with a problem. So I think encouraging families to get their kids checked early on is a good thing.
Thank you for sharing that and sharing some of your background and story. I think that can really, echo to a lot of people in the audience here. We're going to turn back to our eye doctors and focus on what they can really convey to the audience here. What can parents and caregivers do to keep our family's eye healthy? So, Dr. Yoo, would you like to answer what you would recommend that they can do to help keep their children's eyes healthy?
Sure. I think some of the things that you do for your child's overall health is also important for eye health. So just things that we all know, keeping a balanced diet, including vegetables and fruits, trying to keep some physical activities or exercise on the schedule on a regular basis, and then keeping up with visits with your pediatrician, where eye exams, vision screening, eye exams and vision screenings can be done to determine if there is a problem and whether a full eye exam is needed.
Thank you very much. And then Dr. Humes, what would you add for also children, but I know you see adults as well, for those who are caring for adults?
Absolutely. For children, I would say get outside. every day, at least an hour, even 30 minutes. I know it's cold in Michigan half the year, but getting outside and getting that vitamin D, even if the sun isn't shining, is still really important to children's visual, but also their physical development. And making sure that you're wearing sunglasses, UV light glasses, blocking UVA and UVB when you're outside. Starting in infancy. I just bought some for my nephews. They're supposed to come tomorrow. And then in addition to that, as adults, having a conversation as a family, finding out what are the things that are happening in our family with our grandparents and with our great grandparents or with our aunts and uncles. I still ask my patients, do you got a blind aunt or uncle around here somewhere? Do you know why they're blind? And people go, no. I'm like, well, let's find out what that is. Because it's something that we need to check for. Is it diabetes? Is it glaucoma? Is it hypertension? And then in addition to that, getting an annual eye exam once you hit 40 at minimum. And for children, I usually advocate that they have an eye exam before kindergarten, and then again, maybe in 3rd grade, something so that you're getting some regular checkups, especially if you go to a pediatrician that is not doing vision screenings. And if you're a pediatrician that's not doing vision screenings, ask for one. Because that is something that Dr. Yoo actually educated me and told me that's supposed to happen on an annual basis at their physical. And I didn't know that before. So you can always learn new things, even as doctors. So in addition to that, I would say making sure that you're keeping your whole body healthy, just like Dr. Yoo said. So that's controlling your blood sugar, controlling your blood pressure, taking your medications, hydrating, drinking your water, exercising, and getting outside.
Thank you. Those are all important rules we can all live by and keep a healthy lifestyle. I always love, I always tell my patients, what's good for your eyes is good for your body, and what's good for your body is good for your eyes. And I love that connection. Dr. Yoo, another big question that comes up is about screen time, and we're seeing that more and more, especially through the pandemic. Does screen time affect a child's eyes at all? And I know that's a big question.
Yeah, we are all using screens a lot. Including children. And the screens that I'm mostly talking about are phones and tablets, the types of screens that you use up close. And ophthalmologists and optometrists were all observing a trend in children in the last several years of those children developing more nearsightedness or myopia, which is where distance vision is blurry, and developing higher amounts of nearsightedness. And it's thought to be due to overall lifestyle changes of using the screen more, since starting at an earlier age. So taking breaks from the screen time, one way to remember that is a 20-20-20 rule, and that is every 20 minutes, take a 20-second break and look at something far away, 20 feet away. That's one way to remember it. I think taking a longer break can also be good too, and just as Dr. Humes mentioned, an idea for a break would be to get outside if you have a safe area to play outside. And if the weather is nice, to be able to help try to decrease or slow down the prescriptions of nearsightedness getting higher. And the reason for the concern about developing a higher amount of nearsightedness is at a low amount of nearsightedness, it's pretty easily treated with glasses. But when you get to higher levels of nearsightedness, you have a higher risk of developing other eye problems later in life and adulthood. And so it's during childhood that we can try to do some things to try to keep that prescription from increasing a lot and try to keep it more stable.
Thank you. And you all bring up a very valuable point that what we can do for our children now can really make a big difference for their whole lifetime. So as Dr. Yoo was mentioning, we can have a wandering or lazy eye. If that can be caught early, the vision pathway, kids, can develop that. And so they might have 2 functioning eyes rather than 1. And so I really applaud the audience for being here, because it's never too late to see the eye doctor. It's never too late to ask a trusted nurse or teacher at school or somebody in your community who might be dealing with this. And there are a lot of resources. So next, we're going to circle back to our wonderful parents and caregivers on the panel, and really want to circle back to focus on your experiences. Felisa, you started mentioning this, but can you go into a little bit more detail on how you advocate on behalf of your family members who have their eye health problems?
We could go on and on that one. Actually, I try to ascertain what's the most comfortable way for them, for me to get involved. So I start off with, how can I help you? How can I help you with this? And if it's my mother, her first response was, with what? You know, there's nothing wrong. And so for me, I had to actually advocate on behalf of explaining that perhaps at one point in time there wasn't anything wrong, but along with being blessed to live a life that's full, there's some things that may change, and one of those things that have changed are your eyes. And so we're going to make sure that you can stay on Facebook and Instagram and TikTok and all of the other things that she likes to do at 93, and enjoy it. And you won't be able to do that if you can't see them the way you're accustomed to seeing them. And so that helped. That helped. The other was actually going to the visits with them, to be that extra set of ears and a different perspective of what's being said. So that, and I try to translate while I'm in the office, so that when I paraphrase back to my mother what I'm hearing, she then has to acknowledge the information that's being said, because if I don't do that and we leave, we have this debate about, that's not what the doctor said. And yes, it is what the doctor said. And so I go in with her just to do the translation of what the doctor is actually saying and not what she wants to hear. So that's helped. With my son, it's a little different, because as you stated, he's 35, she's 93, and he lives almost 2,000 miles away from us, about 1,200 miles away from us, whereas my mother's lived with me for 27 years. So I'm really relying on his ability to translate what's going on. So immediately I get a hold of my daughter, Tiffany, what is this? And then it just so happened that my friend, one of my good friends, Helen Gandara Zavala, also has keratoconus. So, and I remember when she was diagnosed, we were working together. And so a lot of that sounded familiar to me. So when I got a hold of her, and she was like, this is what's being said. This is what he needs to do. And she's that person now that he's gone through cross-linking, which is one of the procedures to try to stop the progression of the disease. Now that the second part is now understanding that there may be a difference in wearing glasses, because he's used to wearing glasses, but he may need to transition to lenses. There's a fixed mindset around that with him. And she's going to be my real life person who does that, to talk to him about the hygiene, the care, trying to bust some of the myths that he may have, and just to help. So it does take a village. It takes a village to do that advocacy. But in my case, again, the advocacy was really on their behalf to them. And it also helps when you're in the car with your son and he's driving and he's saying, I can't see. And I said, what do you mean you can't see? Well, I can see because I see the lines on the, and immediately you need to pull over. And then we had to have a conversation about what, so listening and not just thinking that they're being dramatic or they're over exaggerating. Sometimes they're afraid.
Yeah.
And some of the things that they're saying to you is about the life change that they're not capable of dealing with right at that moment or later. And so those are those opportunities where you can make it real and let them know you're here to support and to keep things in proper perspective, that it will be gradual difficulties. And sometimes it may be gradual challenges, but they have the resources. The resources are out there for us to be successful in making those transitions. So I would say a lot of it's listening, hearing, and helping them with where they are in the process.
I mean, thank you very much. You bring out so many important points. And, I think that's a big difference. So in your mom's generation, she might have seen a lot of people who just assume blindness was a part of their life and trajectory. And we know now, and we have so much more research and therapeutics and things that we can do. Just like you said, there are resources out there. And there's even from 20 years ago when I started my residency and my training to be an eye doctor, there is so much more that we can do. And there's a network of support from the eye doctors to community health to vision rehab specialists to working with the pediatrician, or your elderly loved ones, primary care doctor. So there's a lot of support. The NEI has a lot of resources on their website, which they'll be sharing as well. And I encourage everyone, the fact that you're here and you're wanting to learn, there are a lot of resources to keep you learning. And I think that's one of the hardest things is that people are not always aware, like you pointed out, that there are resources and there is a community. And the more we can keep that conversation going, you will find people who can help you.
Dr. Goyal, if I may,
Yes.
I also had to learn to push back a little bit with physicians, which we're not accustomed or comfortable doing. And some don't like it, okay? But I know my family member, so there's some things that I just have to say, can you rephrase that? Can you, because I know that that's making the anxiety go. So I'm not telling you to lie. I'm just saying there may be a better way to frame things so that they can embrace it. And once we had those kind of conversations, we were good. We were on the same page. The physician and you should be a team. And so that's the last thing I had to say. So thank you.
Thank you for saying that. And I think that's what I'm director for the students at Wayne State too. And that's one of the biggest things we want to get across is communication is key. And so if you as the family member can advocate and say, you know what, this is not getting across to this loved one or even to myself, that really helps because we're all there as a team there to really help. The patient is the most important person in the room and they're really just another, loved person, part of the community. Patty, I was going to turn to you and also to Sandra. I'll let Patty go first. If your child has received treatment for a vision problem, what kind of positive changes did you see them experience from this treatment? And I know you have 2 daughters going through that.
Sorry. So first, the younger one, she loved school from the very beginning. She was engaged and she got reading and math. So there was no issues with her as far as learning. And she was and I think glasses also showed her to be responsible. She had to be responsible to take care of these, these very delicate things and put them away, in a safe place at night and put them on in the morning, clean them. So it showed her some responsibility. And then also it was nice to, with the screens, she used to have the screens right up, really close to her face. And once we got the glasses on her, she was looking at things normal. And so those were the positive things. With my older daughter, we found out she needed glasses a little bit when she was in middle school, where she'd always come home with headaches. And so I thought, we did do the eye exam, but her vision need was so little that the initial visit, they said, oh, that's probably, she doesn't need glasses. This is not why she's having headaches. And we took her for a second opinion and that little correction I've seen a difference in her headache. She doesn't come home with a headache every day anymore. So those were the positives.
Thank you. It sounds like it's made a really big difference. And it sounds like you have, 2 amazing daughters and it really helped them shine to be all that they're capable of. So that's great. Sandra, how about for you? How did, helping your daughter's treatment, how is that, what kind of impact have you seen, positive or negative, but hopefully for the positive?
Oh, yes. Well, the impact has been so positive because it has reduced my level of anxiety and I'm just kind of emotional about my daughter's condition right from the beginning when she was born. I first of all, let me just uh, backtrack a little bit because when I had her, I forgot that we have this inherited thing, this skin condition in my family and the father's family. I totally forgot about my own family. So when I had her in the hospital, when she came out from the doctor that that delivered her. I mean, that was the attending doctor that day on that day. He said, "Oh, you have oh my God, she's beautiful. She's gonna be the next Miss America." Then I looked, I saw why I was where did this come from? It's because I wasn't expecting. Then the dad said, "Oh, I have this in my family," because I've never met the dad's family back home because I'm from West Africa. So I never
Sandra, I think we'll come back to Sandra. I think we'll come back to. I think the connection might be slowing down for the rest of the audience,
Oh,
and I know you're
really?
sharing a lot of important things. Let's try it again. Go ahead.
Okay. All right. So yes, just to cut the long story short. Okay, I'm trying now. You want me to? I just unmuted my camera. Okay.
Yeah, go ahead. Yeah, your connection. Oh, I think we lost Sandra.
Um,
Sandra,
actually do a research.
yeah,
Can
go
you
ahead.
hear
Your
me?
connection is good
Yeah.
again. Yeah, please go
Yeah,
ahead.
to do it. Yeah, so I had to do a research on albinism because I'm into science field too. I'm a nurse and I'm an LVN. So, but I try to find out what is the cause of this, even though I know that we have it. What are the things that my daughter could be going through? I was started advocating for her when she was little, but I make sure that I understand what is going through in her eyes, in her brain, why she's looking at the prints and all of that. So I found that the eyes is moving a lot, so it's causing her headache and all of that. So what really helped me was the contact that Dr. Primella actually had said that we should start using contacts for her right now. Even though I was in denial, I said, no, 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 I don't like contact. I don't like anything foreign in anybody's eyes, not even my eyes or my daughter's eyes. They said, oh, she's going to benefit a lot. So those things, then we now started using contacts for her. She started using contacts and she's more comfortable with it. And she used to take her books so far when she was reading, during the Zoom time, during the pandemic. She wasn't really struggling with the letters and because she was able to see them very well, even in class right now. So I feel more comfortable because the strong advocacy that I had for her before, I kind of losing my anxiety and my emotional attachment towards her because I'm scared that she won't be able to, because she has never played sports because of her condition. I'm thinking that she won't be able to drive even till now. So those things make me kind of feel so. Sometimes I go to the doctor, I'm crying. Dr. Primella would tell you about that. Tears are coming out of my eye, but I just feel that she's gonna be kind of different from every other person in the public. But with the help of like resources like the blind babies. I was introduced to the blind babies, NOAA, Department of Rehabilitation, and all of that. And Dr. Primella also helped us with when she gets, because she's 16 now. She's gonna be going to uh, a college next year, and I asked Dr. Primella how is she gonna be able to get those things that she need in college, like the resources that she needs to be able to um, be like every other student. So she said, "Oh, these are resources," and she emailed some resources for me. Those have really helped me, and I feel comfortable now that my daughter is doing well and she's able to advocate for herself, which I want her to do all the time. I'm kind of dragging my back out of the advocacy. I want her to talk for herself, tell the doctor how she feels, tell tell me how she's doing, and I'm seeing it. And even at chores at home, she wasn't able to do too many chores because she's not seeing so many things very well. But she's perfect now. She's taking things by the horn and getting her life started, and I'm so happy about that.
Thank you, Sandra, for sharing that. And, it just warms my heart because I find that and I even say the word patient, but I really think of them as a community member or family member or friend, hearing this empowerment and inspiration and how it's really a family support together and then really getting the eye care community behind that and that communication that Valisa spoke up about and that you're sharing too, Sandra. It really is making a difference and seeing the confidence grow. So we really love to end things with a positive note and are so glad to hear from Valisa and Patty and Sandra about your loved ones' improvements and how you're empowering them. To wrap up the event today, Dr. Humes and Dr. Yoo, I'd like to turn it back to you so that we can share some important resources and also some final advice. So for Dr. Humes, what financial or insurance resources are there that are available for those who might be having trouble paying for eye care?
That's a great question, Dr. Goyal. We want to make sure that no one is stopped from ever getting the eye care or the glasses that they need so that they can be successful. So one, the NEI has a whole entire webpage that they'll be posting that has kind of national resources and some state resources as well. And in every state, the federal government has what they call federally qualified health centers. And those health centers offer free or low-cost care, including eye care. So they are in every single state. I'm actually going to post in the chat the Find a Health Center link. So there are health centers near every single person. So there's really no reason not to get some eye care if you need some. And then in addition to that, there are state level resources for those who are visually impaired, which Ms. Sandra talked about a little bit. So every state has a Bureau for the Blind or the visually impaired. And so if you do have a family member who is having difficulty with their vision and has, for whatever reason, certainly you can contact your state as well for additional resources. And then of course, your local Google, put in your zip code, put in eye doctor, and it will give you a list of all of the people nearby to you so that you can get some resources in eye care. Because we want to make sure that every child and every person that needs eye care is able to do so.
Thank you very much, Dr. Humes. And in addition to that, the NEI, as part of the NEHAP program, also has put together some eye health tips. And so that link will also be sent. So there's a lot of different resources and links. And if you're not computer savvy or don't want to be on the web like me, always talk to your family doctor, your pediatrician, or even someone in your community who might be dealing with that. The next question is also just really briefly for you, Dr. Humes, if you could just say in like your top 2 to 3 pieces of advice for families looking to take care of their eye health that they could just remember and take home today.
Some of it is things we've said before, but I'll say again. Definitely number 1, take care of your body because your eyes live inside your body. Number 2, we actually did not touch on this as much. For small children, we really need to limit screen time. Their eyeballs are still developing, and the brightness of screens, as well as how close they hold the screens, we did talk about can actually influence how their eyes develop. So I was asking Dr. Yoo earlier, and she said actually ophthalmologists recommend that children under 2 don't use screens at all. And that children from 2 to 6, I believe it is, that we limit them to 2 to 3 hours a day of screen time, because we really are actually changing the physiology of their developing eyeballs. And then the last one I would say is start the conversation and hold the conversation with your family members. I know in many Black and brown families, even in my own, older family members don't want to talk about the things that are happening with them. Because that's their private information. But we have to try and make that link with our family members that what's going on with you can be passed down to the next generation and the generation after that. And we want to make sure we can do as much preventative care, as Ms. Patty was saying earlier, as possible, as early as we can, so that we can intervene in our genetics. Because genetics we can't fix, but everything else, the environmental, there's absolutely something we can do about that. And the last thing I would say is love on each other. Support each other. We talked about so much about support and community and listening since we got on the call together. And that is key for families to take care of each other, is to kind of spread that love around.
Thank you, Dr. Humes. That was very beautifully said. Dr. Yoo, I'll turn to you next. And I know we're in our final moments, and then we want to go to the audience questions. So what is one final tip or action step you would like to encourage our families listening on Facebook today?
I would say don't be afraid to speak up if you have any concerns about your child's eyes or vision. You could start by even talking to your child's teachers and see if they've also observed any concerns about how they're seeing in school. And then again, your pediatrician is a great resource for a lot of information about your child's well-being and development, including eye health. And if they also have concerns, they can certainly refer you for a full eye exam.
Thank you, Dr. Yoo. That's very helpful information on where to go and next steps. So thank you for encouraging everyone. This next question is also for you, Dr. Yoo. This is from the audience. We're going to turn to that. And thank you to our audience for being so engaged. A participant in our audience is looking for advice for people with children with VHL syndrome. Their children are doing laser treatment, and 2 of them are taking Wilreg drug to stop the growing of all the tumors. They're wondering, is it safe to treat retinal angiomas with cold argon laser while using that Wilreg drug?
That's actually a little bit beyond, or a lot beyond, my expertise. That would be something to talk to. It sounds like you're probably seeing a retina specialist, so talk to the retina specialist that your child is seeing, and also talk to the doctor who's prescribing that medication to help with any other of the angiomas that are present in the body.
Thank you, Dr. Yoo, and thank you to our audience member for that question. And it goes back to all the really good points about communication. So this is one of those, really insightful questions that our audience member has asked. And, I definitely encourage, like Dr. Yoo said, to go ahead and reach out to your doctors, your trusted doctors, or maybe somebody in the community that they know of that you could ask that question to. And the next question is for Dr. Humes, and this is from another audience member. My children get eye screenings at the pediatrician's office and everything has looked good. Do they still need to go to the eye doctor for an exam? I am very nearsighted and worried that one of them will be too.
I would say that if you're worried, you should go. Mother's intuition is above all else. I'm not a mother, but I have one. I have 2, actually. And if you're concerned as a mother, then I would take your children to get a full eye exam, to get the dilation. Sometimes younger children have very strong, what we call accommodative powers, or ability to focus. And so they are kind of compensating for a prescription that may be there. And so when you go in and get dilated and that relaxes the ability to accommodate or to focus, the real prescription will magically appear. And so if you do have a concern, then I would take your child. Absolutely.
Thank you, Dr. Humes. That's very helpful. And thank you to our audience member for asking that really important question. I think I see that a lot, even as a glaucoma specialist. Many eye diseases don't have pain or symptoms early. And especially for our children, they don't know what the world looks like. To them, might be normal. And so if you feel that, there's something that needs to get checked, even as a mom, I just know if I can check the box and have one less thing to worry about, my life is so much better. So, so find that trusted resource and, you can ask. And I think the fact that you're all here today is really showing that initiative and willingness to learn. And so I would say keep the education and the empowerment going. I just wanted to summarize, but I also wanted to give the panelists anything that they wanted to say, because we have a couple more minutes. If you want to raise your hand, then I can call on you if anybody else wanted to share anything, or if we missed anything that you would like to bring up in the last couple minutes here. Doing good? Okay, well, I really, really want to thank the audience and our wonderful panelists, Dr. Humes, Dr. Yoo, Sandra, Valisa, and Patty. Thank you for being here. Thank you for the parents and caregivers for sharing your story. And I feel empowered and I learn from every patient. One of my assignments to my students is from the eyes of your patient. And it's really encouraging them to learn from each other and from their patients and their perspectives. So thank you. I think I've learned as a mom and as an eye professional a lot from you. And to Dr. Humes and Dr. Yoo, thank you for your expertise and your care and your commitment to eye health. And thank you for sharing that. What I would like to say and just kind of summarize, there was so much great content, is keep talking. Get your families talking. A lot of eye diseases run in families. Sometimes they don't have to run in families, but Blacks, Hispanics, and Latinos are at higher risk for eye disease in certain diseases like glaucoma and diabetic retinopathy and cataracts. And so the good news is that many of them can be corrected. And if we can get that early detection when there's not a lot of symptoms, or hopefully no symptoms, we can do a lot to empower your health, your children's health, your parents' health, your aunts and uncles, your cousins, and your friends to keep your community strong. And think about in your own children or loved ones or yourself, if you do have certain diseases like diabetes or high blood pressure. Talk to your doctor. When is the right time to get the eye exam? You can reach out to professionals in your family or your circle that you trust to find that out. But there is that definite connection between our body health and our eye health. And just really just stay encouraged. The fact that you're here today warms our hearts. We all feel very thankful to be a part of this and that we can connect with you. And you have the NEI behind you. You've got a community of support in your village, and your village is big. So we are here to help you all. Thank you all so much. And we'll talk more hopefully soon. So hope you guys all have a great Memorial Day weekend. Thank you.
Thank you.